Hi, I'm Dr. Mark Reeves. I'm the director of the Loma Linda University Cancer Center. The Loma Linda University Cancer Center is dedicated to delivering integrated patient care right here in the Inland Empire. That integrated care is delivered by teams of multidisciplinary professionals dedicated to one specific type of cancer. A key component for the future of cancer treatment here at the Loma Linda University Cancer Center is the Biospecimen Lab for Cancer Research. Research with tissues and blood and bone marrow from patients with cancer helps us to find causes, treatments, and ways to prevent cancer in the future. If you decide to donate your tissue, you will not receive any direct benefit from that, but it will be helping others who have cancer. This process is voluntary. If you decide not to participate, you can still receive your normal cancer treatment. None of the information about your specimen will be given either to you or to your doctor. This is for research purposes only. After you've finished watching this DVD, if you decide to participate in the study, you'll be given an informed consent to sign. A copy of this document will be placed in your medical record, and you will be given a copy of it also. In addition, if you want to speak to a study doctor or a research coordinator about this, you can. After your surgery is finished, the additional tissue that is not needed for making a diagnosis or determining your treatment will be saved in a special way. This will be set aside and frozen and put into special freezers for later research studies. Your personal information such as name, race, gender, and medical history such as your cancer diagnosis and stage will also be placed into a separate password-protected database. Researchers will not be able to identify you personally because your personal identification information will be kept separate from your cancer and tissue information. In addition to the tissue that you'd be contributing, there will be a couple of tablespoons of blood that will be drawn at the time of your standard blood testing for your surgery. This will also be placed into the biospecimen lab. If in the future you decide that you don't want to participate in this research project, you can, of course, withdraw from that at any time. If you notify us of that, we will separate the information about you and get rid of that information from our database. The Institutional Review Board here at Loma Linda University has determined that participating in this project is minimal risk to you. The reason for this is that the tissue that we will be collecting is additional tissue that would be collected as part of your surgery anyway, and it's not needed for determining a diagnosis or treatment of your cancer. There's really no additional risk other than what your actual surgery would bring. Regarding the drawing of blood, there can be small amounts of pain associated with blood drawing, and sometimes there can be bruising at the place where the blood is drawn from. Probably the most important risk is regarding the information that you would be providing about your cancer. However, we take special care to make sure that there is no release of that information by storing it in special password-protected databases that only researchers have access to, and then it's only with the specific identifying information about you removed from the data. There will be no direct benefit to you for participating in this research project. However, as I said before, it's very likely that this will benefit future patients with cancer by finding new treatments or ways of diagnosing cancer. It won't cost you anything to participate in this study. However, you won't be paid anything for participating. If discoveries are made from the tissue that you've donated in the future, you won't retain any rights to this. If you wish to contact an impartial third party that's not involved in this research study, you can contact the Office of Patient Relations at Loma Linda University Medical Center. On behalf of the Loma Linda University Cancer Center, I want to thank you for considering the donation of your extra tissue for cancer research.